Walz administration won't budge on youth sports mask mandate. In a private Facebook group, dozens of parents shared reports of intense headaches, dizziness, nausea, vomiting, and fainting spells among student athletes. Written on January 18th, 2021. Governor Tim Walz's administration won't reverse course on its mask mandate for youth sports, despite reports of students collapsing during practices and seeking emergency medical treatment. State Representative Kristen Rappins, Republican of Maple Grove, authored a letter to the governor earlier this month asking him to reconsider his regulation requiring young athletes to wear face masks during games and practices. We have heard from many youth coaches and parents in our districts who find this mask mandate unworkable and outright harmful to their players. Many people with asthma or other conditions who otherwise have participated in sports will no longer be able to do so, says the letter, which was co-signed by 29 Republican lawmakers. According to the letter, the Centers for Disease Control and Prevention, the CDC, and the World Health Organization, the WHO, and other leading research institutions agree that face coverings during youth sport events pose a potential health risk to participants and may cause more harm than the intended good. A recent survey from Let Them Play Minnesota supports this argument, finding that 14 kids treatment during the first 7 days of practice. In a private Facebook group, dozens of parents said reports of intense headaches, dizziness, nausea, vomiting, and fainting spells among student athletes. These kids really want and need the fun, stress relief, and sense of accomplishment that comes from playing sports and feel they are unfairly harmed by these regulations, the letter concluded. But Department of Health Commissioner Jan Malcolm defended the mandate in a Friday letter. She began by pointing to the 9,457 confirmed COVID-19 cases, which we believe are affiliated with sports activities. This is an increase of 8,005 cases over 3.5 months from the 1,452 that were reported through September 9th. The number of people recommended to be quarantined has risen from 3,348 in September to 18,111 in late December, said Malcolm. Further, because this number only counts the household contacts and does not include contacts on the scene or other social contacts, the number of people recommended to be quarantined is significantly underestimated. The science shows us that large groups, small spaces, and sports create serious transmission risks, particularly when students are exerting themselves without face coverings, she continued. Malcolm said the mask mandate for sports was developed in consultation with youth sports associations and the advice of medical experts, including recommendations of the American Academy of Pediatrics. She acknowledged that the WHO advises against wearing a mask. She said when playing sports or doing physical activities such as running, jumping, or playing on the playground, so that it doesn't compromise breathing. However, the WHO also advises that people always consult and abide by local authorities on recommended practices in the area. In addition, the CDC does not preclude wearing masks, though they acknowledge it may be challenging to wear while playing, especially for younger children. The American College of Allergy, Asthma, and Immunology notes that there is no evidence that wearing a face covering makes asthma worse, said Malcolm. She said youth athletes should take breaks if they were feeling dizzy or lightheaded, and change their face coverings if they become saturated with moisture, according to Let Them Play. Some youth hockey players are experiencing instant saturation of their face masks. The group is currently seeking to overturn the mask mandate for youth athletics through the courts. And then the letter was added here. Article number 2. Minnesota legislature's parents decry mask order as youth sports restart. 30 members of the Minnesota House sent a letter calling on Governor Tim Walz to drop the requirement that youth and high school athletes wear masks during sports. A state order requiring high school and youth athletes to wear masks while participating and competing is not going over well with a group of Minnesota state legislators and supporters of the Let Them Play Minnesota Facebook group. A January 6th letter signed by 30 members of the Minnesota House of Representatives to Governor Tim Walz urged that the mask requirements be dropped, citing guidance from the World Health Organization and the Centers for Disease Control. They said wearing a mask while participating poses a potential health risk to participants and may cause more harm than the intended good. The signers, including the minority leader Kurt Doubt, said many parents and coaches have told them the mandate is unworkable and outright harmful to their players. Many students with asthma and other conditions who otherwise would have participated in sports will no longer be able to do so. As high school and youth sports begin practice on Monday, many parents took to social media to make similar claims. Let Them Play Minnesota, which has also been vocal in support of getting kids back to playing sports, said that it plans to take legal action to fight what it calls Walz's absurd decision to harm youth athletes by requiring masks during sports. During a Minnesota State High School League virtual meeting with school officials Thursday, Executive Director Eric Martin said the league did not ask for masks to be worn during the competition time periods. He told a record 401 interested listeners for the weekly update. We wanted to do what the Minnesota Department of Health felt was necessary to get started. Nicholas Kimball, Communications Director for the state's COVID-19 response, said in a statement, "We all share the same concern, that is, how to keep kids, coaches, and officials as safe as possible during practices and games." The Minnesota sports associations were involved in the decision to implement the mask policy. As with any situation, if someone is having difficulty while wearing a mask, they should take it off. The mask requirement came after Walz put youth sports on hold in November amid a spike in COVID-19 cases fueled by community transmission of the virus. High school games will resume starting January 14th. Seasons will be reduced with fewer games, but the goal of ending them with championships, unlike fall sports, has league officials in discussions with traditional street tournament venues such as Xcel Energy Center and Target Center and the University of Minnesota. No contracts have been signed yet, said Bob Madison, league associate director. The league previously approved dates for potential state tournaments. Now includes the possible scenarios of basketball ending the week of March 29th and hockey ending the week of April 5th. With a nod to KSTC 45, the league's television broadcast partner, Madison said that staggering those two sports states tournaments is important. With each sport, however, the possibility exists of tournaments for boys and girls sharing the same week. "We are nowhere near finalizing plans," Madison said Thursday. "The ink is barely dry on the NHL schedule, and we're waiting on the NBA schedule to be made public." Indoor venues such as gyms and arenas must limit capacity to 25%, with a maximum of up to 150 people. The governor announced as part of loosening several restrictions he ordered to counter the pandemic. High school bands and halftime performers are prohibited during the winter season. A limit of 2 spectators per participant for competitions is recommended according to the information shared by the league's meeting. Concession stands for food and beverage sales are not encouraged, but they are allowed if they follow appropriate guidance, eliminating gatherings, and have a COVID-19 preparedness plan, school officials were told at the meeting.